Assalamu alaikum everyone. I am Dr. Maimona. In our last lecture we have discussed till cardiac cycle from the cardiovascular system. Today first of all we will see what is ECG. ECG is also known as EKG and ECG stands for electrocardiogram. It is basically the recording of electrical activity of the heart. And hopefully all of you have seen the ECG strip. This ECG strip has different waves. The first wave is called P wave, and this P wave represents atrial depolarization. Next is QRS complex. QRS complex shows ventricular depolarization. Last wave is called T wave, which represents ventricular repolarization. So that was all about ECG waves. Next is heart sounds. How the heart sounds are produced. Heart sounds are produced due to turbulent blood flow. Turbulent blood flow means irregular flow of the blood. And this irregularity in the flow of blood is produced during the closure of heart valves. So the first heart sound, also known as loop and S1, is produced due to closure of AV valve. AV valve means atrioventricular valve. On the right side of the heart, the AV valve is also known as tricuspid valve. And on the left side of the heart, the AV valve is called mitral valve. So the first heart sound is produced due to closure of mitral and tricuspid valve. And in which phase of the cardiac cycle first heart sound is produced? It is the ventricular systole. When the heart is contracting, first heart sound is being produced. Second heart sound is also known as dub, S2. And it is produced due to closure of semilunar valves. On the right side, the semilunar valve is pulmonary valve, and on the left side, the semilunar valve is called aortic valve. And this second heart sound is produced when there is ventricular diastole, means when the heart is relaxing, second heart sound is being produced. Now coming towards a very important topic, that is the cardiac output. So the definition of cardiac output is, it is the volume of the blood that is pumped by the heart per minute. It can be represented in milliliters per minute or liters per minute. So all the blood that is pumped by the heart in 1 minute is called cardiac output. Formula for the cardiac output is heart rate multiplied by stroke volume. Heart rate is basically the heart beats per minute. And stroke volume is the blood pumped by heart in every heartbeat. So you have to remember the difference between the cardiac output and stroke volume. Stroke volume, stroke means beat. सो एक बीट में जितना ब्लड वॉल्यूम इजेक्ट होगा, that is called stroke volume. It can also be defined as blood pumped by the heart in one stroke or in one beat, right? So the difference between the cardiac output and stroke volume is, cardiac output is all the blood pumped by the heart in 1 minute is called cardiac output, and the blood pumped by the heart in one beat is called stroke volume. Stroke volume, normally it is 70 ml. It means that in one stroke or in one beat 70 ml is being ejected, and the heart rate is 72 beats per minute. Cardiac output is 5 liters per minute. Cardiac output can be greatly increased in exercise to around 25 liters per minute and in athletes up to 35 liters per minute. And this increase during exercise is called cardiac reserve. Here I have written some important definitions. So first of all, the definition of heart rate. Heart rate is defined as heartbeats per minute. Stroke volume. Blood pumped by heart in every heartbeat, or the blood pumped by heart in one beat, is called stroke volume. And diastolic volume. And diastolic volume is also known as preload, as its name indicates that it is the volume of the blood at the end of diastole. और diastole के end पे क्या start होगा? There is beginning of systole. So the volume of the blood in ventricle before it's begin to contract is called end diastolic volume. All the blood in the ventricles at the end of diastole, just before the ventricles begin to contract, is called end diastolic volume, and the other name is preload. Venous return, amount of blood returning to the heart through superior and inferior vena cava, is called venous return. Now the factors affecting the cardiac output, as we know that the cardiac output depends upon the heart rate and the stroke volume. So all the factors which affects the heart rate as well as the stroke volume are indirectly going to affect the cardiac output. So cardiac output can be increased if there is increase in the heart rate and there is increase, or instead of and we can say if there is increase in heart rate, cardiac output is going to increase, and if there is increase in the stroke volume, cardiac output is going to increase as well. So cardiac output basically depends upon the heart rate and stroke volume. Now let's see what are the factors upon which heart rate depends. On the left side you can see the heart rate depends upon the autonomic innervation. Autonomic innervation includes sympathetic and parasympathetic innervation. Sympathetic innervation increases the heart rate and parasympathetic innervation decreases the heart rate. Next is hormones. There are certain hormones that increases the heart rate, and the example is epinephrine and norepinephrine. Electrolytes, for example sodium, potassium, calcium, they can also affect the heart rate. Position of the body, either the lying position or the erect position, both these positions affect the heart rate. How? During erect position, or erect position is the standing position, so the heart rate is increased during standing position. Emotional states, when a person is having anxiety, when a person is anxious or emotionally unstable, the heart rate increases, while when a person is depressed, heart rate decreases. Gender. So heart rate in females, heart rate is more, or the heart rate sorry for the pause. So in gender, females has more heart rate than the men, and age, in children the heart rate is greater than the adults or the old persons. Temperature, increase in the temperature increases the heart rate. Baroreceptor reflex, through baroreceptor reflex, heart rate can be increased when there is fall in the blood pressure. There is increase in the heart rate through baroreceptor reflex. Now coming towards the stroke volume, the factors which affects the stroke volume. On the right side you can see the stroke volume. The first factor upon which the stroke volume depends is the end diastolic volume, And diastolic volume, we have already discussed that all the volume in the heart at the end of diastole or just before the ventricles begin to contract is called end diastolic volume. So when there is increase in the end diastolic volume, stroke volume is going to increase, and this end diastolic volume depends upon the venous return. अगर venous return ज़्यादा है तो end diastolic volume ज़्यादा होगा, और जब preload ज़्यादा होगा तो stroke volume is going to be increased. Second factor upon which stroke volume depends is the contractility of the heart. Increase in contractility of the heart increases the stroke volume. This contractility depends upon the autonomic innervation as well as on the hormones. In autonomic innervation, sympathetic activation increases the contractility of the heart, and parasympathetic activation decreases the contractility of the heart, and so the stroke volume. And there are different hormones, for example epinephrine, norepinephrine, digitalis, that is not a hormone, that is basically a drug. And in hormones we have glucagon, we have thyroxine, which increases the contractility of the heart and leads to increase the stroke volume. So in this flow chart you can see all the factors which can increase or decrease the cardiac output. Venous return. So venous return is basically equal to the cardiac output. All the blood that is returned to the heart is being pumped by the heart in 1 minute. So venous return determines the cardiac output. Cardiac output is equal to the venous return, and it is the major determinant of the cardiac output. The factors affecting venous return, first factor is position of the body. Venous return increases in lying position as compared to standing position, because standing position में gravity act करती है, और due to the effect of gravity venous return is decreased, while in lying position gravity का effect minimize हो जाता है और venous return increase कर जाता है. The second factor which affects the venous return is muscular contraction. Basically this is the skeletal muscle contractions, and we have valves in the veins which help in one-way flow of the blood towards the heart. So skeletal muscles surrounding the deep veins compress them and pushing the blood towards the heart. This is called the skeletal muscle pump. The third factor upon which venous return depends is the respiratory pump. And during inspiration, there is expansion of the chest, and this expansion increases the negative pressure inside the thorax. This negative pressure acts as a suction force, so it sucks the blood towards the heart. So this negative pressure that is created in the thorax during inspiration, this increases flow of blood towards the heart. And the other factor that acts during inspiration is diaphragm moves downward, and when the diaphragm moves downward it increases the intra-abdominal pressure, and due to this increased intra-abdominal pressure blood is pushed towards the heart. So these were the three major factors upon which the venous return depend, and we have discussed that cardiac output depends upon the venous return. The one of the major determinant for the cardiac output is the venous return, or you can say one of the major factor upon which cardiac output depends is the venous return. Next is heart rate. If heart rate rises, cardiac output rises, or the increase in the heart rate leads to increase in the cardiac output. The factors which determines the heart rate: autonomic nervous system, we have sympathetic and parasympathetic activity. Number 2 is circulating chemicals, which includes adrenaline, noradrenaline, thyroxine, hypoxia, and increased levels of carbon dioxide. All these chemicals increases the heart rate, while hyperkalemia is increase in the levels of potassium in the blood. So increased levels of potassium in the blood is called hyperkalemia, and this slows down the heart rate. Last factor is beta receptors antagonists, for example atenolol. Beta receptor antagonists are the drugs basically which are given to lower the blood pressure. तो ये blood pressure की एक drug है जिसका नाम है atenolol. It also decreases the heart rate. Third factor is position. Heart rate is faster in standing position than the lying position. Exercise increases the heart rate. Emotional state, that is excitement, fear, and anxiety, heart rate is increased. Gender. Heart rate is faster in women than in men. Age. Heart rate is more rapid in babies and in small children. Temperature. Increase in temperature increases the heart rate, while decrease in temperature decreases the heart rate. Baroreceptor reflex. Decreased blood pressure causes increased heart rate through baroreceptor reflex. Thank you very much.